Good evening, everyone, and thank you very much for joining today. Just before we start, if anyone has any problems, please let me know through the chat. And there will be time for questions after the presentation, but please feel free to type in your questions during the talk via the question field, and I shall then pass them once the presentation is finished. Then now I'd like to give the floor to Michelle Batté. She's the Program Manager of ERN EUROGEN.
Good evening, everyone, and welcome to the EUROGEN webinar programme. Just before we start the talk, I'd like to give you a brief overview of what the European Reference Network is and what we do. ERN EUROGEN is one of 24 European reference networks which cover different medical fields. They were created by the European Commission in 2017, and they all deal with patients with rare diseases or complex conditions that require highly specialised healthcare. The aim for us as a network is to try and deliver faster specialist evaluation and more equitable access to high quality diagnosis, treatment and care for those patients with rare urogenital diseases or complex conditions that need that highly specialised healthcare. I'm delighted to say that very recently, at the beginning of the year, we welcomed 30 new healthcare provider members into the network following the European Commission's call for new members. So now I think we're at nearly 70 healthcare providers. So we have a great opportunity to spread knowledge across such a big network. So briefly on our activities, within the network, we collaborate using a clinical patient management system, which gives us the ability to conduct a virtual European level MDT between specialist centres. And this enables us to give highly specialised advice to any healthcare professional in any EU country that requests it. We can give them guest access to the system. We also collaborate in education and training, such as with these webinars, and we also have a clinical short-term exchange programme where we can offer visits between our healthcare providers. And finally, we're working on building a EUROGEN registry, which will be very exciting. It's being rolled out now as we speak. So the hope is that we can very quickly, with such a large number of hospitals, gather some really useful clinical information so we can get a baseline of current clinical practice for these patients and do some really, hopefully, some really interesting research. So without further ado, I'm delighted to welcome Dr. Rosanne Smits. She's a researcher and medical psychologist at Radboudumc University Medical Centre, which is the coordinator of the European Reference Network. She specialises in psychosocial needs for rare diseases in Radboud. And really, she wants this evening to underline the concepts of rare diseases and how there are some overarching concepts that we should take account of in the hope of giving children and their caregivers a better service, improvements in their care. So Rosanne, you're going to talk to us today about common challenges in uncommon conditions. So once again, thank you so much for doing this evening and sharing your expertise with us.
Okay, hello everyone, good evening. Thank you, Michelle, for the kind introduction. So today I'm going to tell something about the research line Common Challenges in Uncommon Conditions. My name is Dr. Rosanne Smits, and I have a research line together with Dr. Chris Verhaak, which I'm delighted to share with you today. So first and foremost, I want to declare that we have no conflict of interest, and we will tell something today about this research line. So Common Challenges in Uncommon Conditions, which mainly focuses on reducing psychosocial vulnerability in rare disease and has sort of a new or novel approach in the sense that we are combining all rare diseases and to see how we can support the needs that are overlapping and that are present across all diseases, instead of that each disease has a very specific part in this. So that's the main aim. So I work at the center of an expertise center of rare disease in the Radboudumc in Nijmegen, the Netherlands. As you may be aware of this, a rare disease in Europe is defined as 1 in 2,000, and in the States 1 in 1,600. But there are a lot of other countries that define rare diseases in different ways. But today we're here at EUROGEN, so important that 1 in 2,000 is a very important number. So the challenges in rare diseases are in research and in clinical care is that the studies are with small sample sizes, that there's a large heterogeneity of the phenotypes, so it's very different how a disease manifests within diseases. There's limited insight in prognosis or in unpredictable disease course. There are limited insights in quality of life and psychosocial outcomes. So this last aspect is something we want to focus on in this research line. So here are some famous quotes for the rare diseases. So there are between 6,000 and 8,000 rare diseases, which means that although each disease is rare, it's not rare to have a rare disease. And that rare diseases affect 30 million European citizens. So that's a lot of people. And that 80% of rare diseases are of genetic origin, often chronic and life-threatening. Also meaning that they're genetic, that they often occur in childhood. So that's why it's very important to focus on children. So in line with our research line, we were very delighted to hear it because the research line started 1 year ago, and in 2021 we heard that there were recommendations from EUROGEN, which is the patient voice for rare diseases in Europe, and that they published recommendations for the next 10 years. And one of the very important goals was to reduce the level of psychological, social, and economic vulnerability. And this is a very important goal because it really brings forward the importance of why it's so important to focus on this goal, and that it's so underrepresented to support psychological well-being in rare diseases. So they studied this in patient networks, and we also saw that, for example, 7 in 10 patients and carers expressed that they stopped working, that a lot of people shared that they were that their mental well-being was suffering, and that 2/3 of the carers spend more time than 2 hours on a day on disease-related tasks. So it's really important to get an insight of the disease burden. And other results from this rare barometer was that patients addressed that 37% felt unhappy or depressed, compared to 11% from the general population. And another example was that 58% think that it's possible within 10 years they could get the psychological and emotional support they are lacking today, stating that there is a great deficit in psychological support for people with a rare disease. So this really needs to change. So this is the research line that we together are working on. I'm a postdoc researcher, and I work together with Dr. Chris Verhaak, a clinician and researcher in the Amalia Children's Hospital in the Netherlands. So the research line has 3 separate goals, and the first goal is to explore psychosocial needs for care for children and families with a rare disease. The second goal is to network and create visibility within the rare disease network, so gather more representation for psychosocial needs. And the third goal is to develop tools and interventions together with patient networks suitable for many rare diseases, with add-on modules for disease-specific needs. So the first line, or the first goal of the research I can share, I really like to share some outcomes with you about this. So the goal was to identify psychosocial needs in rare diseases. As I've said, we work in an expertise center for rare diseases, and there are several rare diseases that the Radboudumc specializes in. So for example, mitochondrial disease, Prader-Willi syndrome, differences in sexual development, urogenital disease, anorectal malformations, and rare kidney disease. And in the literature overview, which was the first research method that we tackled to identify these needs, we looked for overarching concepts in, for example, quality of life or caregiver burden across the diseases. And actually we did the same, but based on qualitative data. So we analyzed the interviews of parents with children who have a rare disease, and these were the diseases that were included in the study. So these were anorectal malformations, urogenital disease, epilepsy, no diagnosis, Turner syndrome, metabolic disease, and fetal alcohol syndrome. So from the literature study overview, the background again was that quality of life and psychosocial determinants are under-researched in rare diseases. So it's also very important to know, as I've stated before, that there's not much attention for psychological well-being in rare diseases, but that's unfortunately developing. But a lot of research and funding is going to genetics and more of the medical model in rare diseases, but it's also very important to have more attention and more of a platform for the importance of psychosocial vulnerability. So yeah, that's why we explored the common needs for these 6 rare diseases. And we created a search string for this, which was based on the diseases, but also on the psychosocial or psychological concepts about this, for example, quality of life. And that we had 56 articles that were selected to study the needs for each condition. So these are the results. So for example, in mitochondrial disease, we saw that there was need for information, need for coping and communication, practical support in healthcare, and concerns about inheritance. But also important, of course, for EUROGEN is that in the urogenital diseases, for example, that there was a need to know more about quality of life, for information in sexual development, body image, and transition to adult care. And for anorectal malformations was more sex and fertility. There was not a lot of information about this. Holistic approach, transition to adult care, the role of the caregiver, and the difference in sexual development was a need for information about sex and fertility, non-binary information, a holistic approach, role of the caregiver. So a lot of similar concepts across also the diseases that pertain to EUROGEN. And one striking result was that we found for a lot of diseases that there's a need for information, which is of course for rare diseases is evident, but also very important to know how to cope with the lack of information. So yeah, this was a striking result. And for the qualitative analysis, we wrote a paper about the interviews which we submitted to Orphanet Journal of Rare Diseases. We are taking care of the revisions now, but hopefully in the future this will be published. So again, we looked at the overarching concepts that shape the general experience of having a rare disease. And the present study examines common needs, but from a comprehensive perspective. So as I said, we are, my background is in medical psychology, and we were looking at the important concepts of rare diseases, but also in pediatric psychology. And based on this, we formulated interview questions, and we found 8 themes that uncovered the need in rare diseases, and those were family-focused care, coping with uncertainty, empathic communication, practical support, information, psychological support, interdisciplinary care, and social support. So this is the model that we used for this approach, so pediatric psychology and rare diseases. So important concepts are a developmental approach, which is very important for pediatric psychology. Family-centered approach, because in psychology, and especially in pediatric psychology, we really focus on the network of the child. So if if the child is safe and enough and to develop, but also to is the network capable of really supporting in the care for a rare disease, which is a very important aspect, and an interdisciplinary approach, which is a very often expressed concern in rare diseases. So based on that, we formulated the interview questions, and we found the needs, as I mentioned before. So these are the results. Again, we found, for example, in anorectal malformations, that uncertainty was a very important point, and the need for information, empathic communication, which not the interviews did not mean that the healthcare professionals will mean with empathic communication, but more that they felt not understood. Another important aspect is family-centered care, so that next to the care for the child that suffers from a disease, it's very important to also support the brothers and the sisters, but also the parents, to see if they need psychological guidance or something else. So they addressed that point. But what also was striking is that we saw the same concept that kept coming back, and that was uncertainty and the need for information, very important concepts in rare disease. Yeah, so once again, to highlight this is that, yeah, that was very often mentioned that there is a need for information and uncertainty. And uncertainty is a very large aspect in medical communication. So there are also a lot of intervention about coping with uncertainty. So even though the information is not there for rare disease, it's also very important to know how to cope with the lack of information. Yeah, so to summarize our literature and qualitative research, I'm also very, yeah, I hope to hear from you if you can relate to this. But we found these 8 concepts. So family-focused care, dealing with uncertainty, empathic communication, practical support, need for information, psychological support, interdisciplinary care, and social support. But this last one, social support, was also frequently mentioned, and for especially because people with a rare disease, they felt not understood by their social networks, because if you would tell your family that your child has, for example, cancer, then people are very shocked and they sort of know how to react. But if it's a disease that's not known to a lot of people, then people feel misunderstood, or sometimes that people forget that you have such a high burden in life for caring for someone with a rare disease. So this was also a need that was often mentioned, feeling misunderstood by your social network. So the second goal of the research line is rare together. So yeah, it's very important and also very evident, because I'm speaking at the European Reference Network, that it's important to work together for the rare diseases and create visibility, to gather more representation for psychosocial needs. So there are a lot of a lot of organizations that address rare diseases, and there are so many 6,000 to 8,000 rare diseases, as if it's all small islands, but it's so important to work together on this, and also together on the psychological well-being. So it's a very important goal, and we're very open to collaborating. So this was a poster that we presented for EUROGEN in 2021, and it summarizes the research line. So it's connecting rare diseases and also identify the needs to develop tools for all and to reduce psychosocial vulnerability. And this was very well. People really liked the idea, but of course also the recommendations were the same for that year, but it really spoke to a lot of people from EUROGEN. So our third goal is to develop tools for all, together with patient networks, and suitable for many diseases, but you can always develop add-on modules for disease-specific needs. So now that we know, based on our literature research and on our qualitative, so the interview data analysis, we know what needs there are in rare diseases, and we sort of now have the building blocks which represent the needs, and now we have to tailor interventions to address these needs. So the first thing that we did, and that was very evident in the interview analysis, was the practical information that a lot of people said that they were missing or they could not find, and uncertainty. So we made a flyer with very concise, easy, and practical information, what it means, what it could mean to live with a rare disease, and some of the problems that people face that have a rare disease, so that they're not alone in this, and that's not that is not weird, or that's very common that people experience that. So I think people feel supported in that. But we also made a sort of roadmap to let people know whom they can talk to. It may be a psychologist, but could also be someone who supports the education facilities for a child. So this was very important. One of the first things that we did to address the results from the analysis. Another important tool is a very commonly known tool in pediatric psychology, but it's called the PET, psychosocial assessment tool. And this tool addresses or assesses actually how vulnerable a family is to provide for the child, but also to see where we can support the child and the family. So that's also very important to know, because if there's support lacking, then people cannot really provide care or receive healthcare, and that will be a waste in healthcare. So it's very important to support these deficits if these are there. So the third goal are interventions that that focus on more specific but also general complaints for rare diseases, for example, pain, fatigue, acceptance, and loss. So these are general complaints, but they speak to a lot of people. So there are a lot of interventions tailored to these complaints. And lastly, the communication, which is a very important aspect and also something that a lot of parents addressed in the interview analysis, is how you can manage expectations, but also address uncertainty. So uncertainty is a very broad concept, and also has been researched a lot, also in cancer research. And it's very important to address uncertainty if it's there, so that parents or children don't think afterwards, am I the one who's not understanding this, or is it just uncertain for everyone? Is the information not there? And that's something that's very important to address in the communication about uncertainty. So this is one of the examples that could be used. So those were all the separate goals of the research line, and also the outcomes and the tools that we would like to develop, but also very hopeful and but also eager to work together. So please let us know what your thoughts are about this. And the take-home message from this presentation was to combine expertise to support common needs. And I'm looking forward for your questions. Thank you. Hello, everyone. Please let us know if you have any questions about the research line, or it was recognizable if you saw the needs that were explained.
Thank you very much, Rosanne. There are no questions yet, so everyone, please feel free to type in your questions. We will pass them to Rosanne and Chris. Well, the first question, I will read it out loud. Can you please say some words about coping, self-efficiency, practical, or what did you find most essential?
Well, for now, we mostly looked, or the research that we conducted so far was about identifying the needs or the challenges that are there. So I think it's now what's missing really is to develop interventions and tools, and those still need to develop that are especially tailored for rare diseases. So I think there will be different aspects in how to cope with certain aspects, for example, uncertainty. So I think it's very important to develop this together with people who have a rare disease to see how these needs can be met.
I'm forwarding some questions to you. Can you read it?
Let me see. I think I can. Oh, I see in the question box from Farid. Great lecture. I would like if these articles can be translated in other languages. So we're right now we've submitted one of the articles in for journal, and it's under revision, so it will be available for everyone who wants to read it in English. But maybe in the future it could be translated to other languages as well. I see another question. What if parents or the child deny psychological help while they do need it? I think Chris, as a clinician, is someone who has experience with this.
Yeah. It of course depends a little bit on the specific situation, but what we know from clinical practice that many times parents and children also like some psychosocial support from their primary healthcare professionals, so from their doctor or from the specialized nurse or the nurse that's involved in the care for the child. So probably you can ask advice if you have specific questions to a psychologist, and you can then translate it in your communication or your support to the parent or the child. So sometimes it's too much for parents to also go to a psychologist, and also sometimes they think I'm mad that I have to go to a psychologist. And then it's important to explain that psychologists in a hospital can help people dealing with a disease in daily life, specifically providing support in also practical issues that you are faced to in dealing with invasive medical condition. So not only emotional things, but also practical support. So that's also could also be important to address. So it depends a little bit on the specific situation.
Yes, thank you. I see another question from Marjolein Bos. When children grow up, they have to deal as an adult with a rare disease. Do you know research on this, or do you know interventions? Well, while looking at the literature research and about the differences in sexual development, but also urogenital disease, this was a very this was one of the results that came across, that there's a need for more transition to adult care, so that a lot of children are lost actually, or that the care is not as intensive as they are used to in pediatric care. So this is a very much or frequent addressed complaint from children, that they felt not supported while making the transition to adult care. So I know that there's a need to develop more for this.
Yeah. It's also important to realize, because it's an important issue, that in every developmental phase, there's also, especially from adolescence to adulthood, so when the child or the patient reach autonomy from the parents, but also in other phases, so the phase, the transition from primary school to secondary school to puberty. So all these different phases need some specific attentions to match the challenges of the disease to this specific situation of that specific age.
Okay. Oh, I see a lot more questions now. Information needed. Information about the disease, condition, healthcare connection, or I think it's to specify what's meant with informational needs. I think this was addressed in the interview studies as well, but also in the literature study. And what people with in the interviews, because that's where we could really explore and see an in-depth vision of what people told us about these informational needs, is that there was information, but that sometimes they could not find it, or sometimes it was too medical, and that they did not quite understand what was happening. And what was also mentioned is that people, when they are in the hospital and during the consultation, a lot of information gets lost, and they would really like a checklist afterwards to see what, to summarize what happened or what's happening to their child and what they can do. So these are informational needs, so more concise and more practical, less medical. I think that's the most thing that came forward. Yeah, so Ala Chekilard said, "I'm not crazy," or "I don't need it," that parents address that.
Yeah, there's sometimes a lot of misunderstanding about the role of the psychologist.
Yeah. Okay, Heidi, thank you for really interesting to know that many challenges are similar for rare disease. What sort of psychotherapy do you think will help? We focused on music and dance to support our children's well-being, but this had huge financial implications for our family. Yeah, what kind of psychotherapy can help? I think it also depends on the disease, of course, but if we're looking at developing general tools and looking at the general experience of having a rare disease, I think overall also coping with uncertainty is a very big aspect. Yeah, Chris, what do you think as a clinician? What kind of psychotherapy applies to a general approach?
Yeah, it depends. It depends on the specific question for the child and the family involved. But I can imagine that in your general diseases, there's also probably need for support for specific disease management that could be very challenging for children and parents. And then more cognitive behavioral support, so support in planning and organizing disease management aspects could already be an important issue of psychological support. I wouldn't say that's psychotherapy. Psychotherapy, more psychotherapeutical approaches could be focused on acceptance of the limitations of the disease. And if you think that parents or children specifically dealing with the loss because of the disease, specific loss in their daily lives, then also attention for acceptance could be important. But also some shorter interventions on specific to support specific coping, cognitive behavioral therapeutic interventions could be useful. So it depends a little bit on the specific question and the specific situation of the child and the parents. But there are many options available. So that's also what we want to show in this presentation, that there are many psychological interventions, also shorter interventions for parents and children that could be used in specific situations, also parents and children with rare diseases are dealing with.
Yes, thank you. So another question from Farid. All rare diseases are a spectrum, needs collaboration and teamwork. What is your advice for parents to receive a primary best outcome so they will not suffer from preventable complication or follow-up? I think in this case also very important to know that there's a difference, that also psychosocial outcomes need to be included in this, so the well-being of the child and quality of life. So yeah, what's the best primary outcome is now a sort of disease activity, a skill in every kind of disease that there is. But I think it's also important to really know more about how you can psychosocially support a family and a child. Yeah, I think that's the main conclusion that we drew from our research right now, but we still have to develop a lot of tools to support patients with rare disease. Continuing, healthcare system for adolescents, or please explain more specifically what priorities within information is needed. I don't know if I understand this question. Healthcare system for adolescents, or please explain more specifically what priorities within information is needed.
I think this was a addition to an earlier question, which you already answered. So I think we covered that.
Oh, okay, nice. Can a general psychologist offer these kind of care, or do you need a specialized doctor? Chris, what do you think?
Yeah, that's a very important issue. So we many times we realize that patients have the experience with general psychologists that they feel a sort of incompetence to deal with problems to handle the problems of a patient with a rare condition. But what we see, and that was also part of this presentation, that in general, so 90% of the psychological issues, of the general psychological issues, could be also are also applicable to a specific situation of a patient in a rare disease. And what we do as centers of expertise in the Netherlands, and we collaborate with a colleague in the closer environment of the patient. So, for instance, we are at the east side of the country. So, if there's a child with a specific condition in the west side of the country, and there's a need for a psychologist, then we contact a specific colleague in the environment of the patient, and we give some specific advice how they can treat this specific patient. So it is a kind of a consultation, also from the perspective of the psychosocial care, that is important. And I think it is a little bit the same as what a medical professional in a center of expertise does with, for instance, a general practitioner or a general doctor in the child's environment.
Yeah, so with good collaborations, a general psychologist could also be of great help. Yeah. I think we came to the last question from Farid. Controversies in DSDs regarding consent, timing of a staging procedure, how you advise family. I don't know if this pertains to the consent because of the age of the child, but the procedure is done.
Yeah.
Yeah, I know from the literature search that there was a paper consensus statement about that there needs to be more discussion about the age of the child because because children cannot consent to this. So I know that there's a discussion about this, which I can fully understand.
Yeah. Indeed, there are controversies, and because ideally you would like to have informed consent of the child for especially surgical interventions, but in some situations you can also make other decisions. But it's also always important to adjust or to match the interventions to the specific situation of this specific child and these specific parents. So, but that are delicate issues, and I don't think we have a general recipe for that. So, but it's an important issue, yes.
Yeah. There's another question from Farid. Do you think that during the transitional period, an adult psychologist knows about the rare disease or not? I I think it depends
Yeah.
also on the network.
Yeah, that's a little bit the same as what we said about a general psychologist in the closer to the direct living environment of the child and the family. So also the adult psychologist has could probably rely on the knowledge of the colleagues from the child department or from other colleagues in the countries that are specialized to this specific rare disease.
Yes. All right, so I see that there are no questions anymore. Well, thank you everyone for all the questions.
Yeah,
really
and for
nice to have
interesting questions, giving a good discussion about these issues and also the difficult issues we encounter.
Yes,
Thank you, Rosanne. Thank you, Chris, for your very nice presentation. Thank you everyone for joining tonight. The webinar has been recorded and will be available on both our GoToWebinar platform and the YouTube channel. And I will send the links tomorrow, and all links for the previous sessions are on our website, and as well are the details of the forthcoming webinars. Finally, all of you who have attended today will receive a survey immediately after the session, and we would be very grateful if you could spend a few minutes filling it in, so we could continuously improve further sessions. And for now, thank you all very much. I'm sorry for the technical issues, and we hope to see you again. Have a good evening.
Yeah, thank you for the opportunity. Thank you.
Yes, thank you, Luz. Have a nice evening, everyone.